Hi everybody, my name is Rhys Barber. I'm one of the audiologists here at Audiology Associates. Thank you very much for watching that earwax removal video today. So we've got 3 patients coming up in this compilation video. I've got one of Taylor's, one of mine, and back to Taylor again. On my own today, the lovely Taylor Green. I'm doing this before he comes to work actually this morning. But wax vent starts Monday, guys. So this is actually Taylor's patient, and this patient was actually very, very nervous. They're a regular patient that comes through to see us, and although they are super duper nervous, bless them, they really do come through on a regular basis because it's a lot easier when you've got a nervous patient if you're taking a little bit of wax out compared to a lot of wax, because obviously you don't, when somebody's very, very nervous, they're always a little bit kind of worked up before they come in, and the longer you spend in those ears, then the more nervous that patient can actually become. So what you can see is a very, very soft type of wax here. So he's doing really, really well to lift this up, just clearing this entrance here. Guys, it was actually Men's Mental Health Day last week, and I completely missed it. And this is something that's really kind of close to my heart because I do suffer a little bit with my mental health and had a little bit of a wobble recently. I'm doing okay now, but obviously I had a lot of support from Mrs. B, from my family, and I actually went and got some help, some professional help as well. So I'm doing really, really well, and I'm doing a lot better. But you guys have probably noticed that the videos recently have maybe been a little bit flatter than they normally would be. I was really nervous to talk about this on camera because it's not something I really open up about too much, and not so much about opening up, but I suppose getting the right words. What I really wanted to say, I think, was I'm really gutted I missed it last week because obviously I was kind of concentrating on other things, but it's really important if you guys do suffer with any kind of mental health issue, that you really do seek help, because it does make a massive difference. And this channel's got a fantastic following, and we've got really, really good viewers and subscribers, and they're all really, really lovely and really supportive. And I think that don't be afraid to reach out and talk to somebody. If you are suffering a little bit, don't be afraid to reach out and talk to somebody, because I think it from my experience, it makes a massive difference, and it really, really does help. And if we can help just one person out of, I think we've got 1.8 million subscribers now. If we can help anybody to do that, I think that would be a massive difference. So don't suffer along by yourself, guys. Make sure you speak to somebody, because it really does make a massive difference. But I'm back. I'm feeling loads better. I'm feeling a lot more upbeat about everything. So we're coming back big and strong now this week, and we're just about to go to wax vent, so it's going to be a good old time for us, okay? So yes, thank you for bearing with us over the last kind of period, okay? Now, back to the wax removal, sorry guys. So with the wax removal here, what we can see is this is a really, really interesting patient, this one. This patient had an extreme tremor, and I don't mean just a tremor, I mean a whole, almost like a physical, their whole body would move quite violently, okay, and they had no control over it, bless them. And things like light would trigger it, noise would trigger it. So they've been to lots of places, been really, really struggling with their ear, and you can see why it's so impacted and so deep inside this ear canal. And what we've got here now is this poor patient who was really struggling to find anyone to take this wax out because it was so deep. You couldn't use curettage. They were really didn't want to have to do irrigation. They really didn't like this because they knew that would trigger it off. And if you've got somebody that's moving, no control over arm movements, head movements, nothing at all, and they were extreme, like big movements, putting water in somebody's ear, the water's just going to go everywhere as well, bless them. So I did say we could do a little bit of suction. So what you can see now is I'm going in like really carefully. If anything, you see one of the worst places is right down on top of the eardrum as well, and it's a lot of skin, a lot of wax, so there's usually a bit of noise, lots of pops and squeaks, but every time I got a grip on a piece of wax and started to pull, this lovely lady, and she was an absolute trooper, she did so well. I could see she was really trying desperately to stay as still as she could, but I could see when things were going to go. So you'll see a lot of quick movements out of the ear, and this is why it's really, really important as audiologists that we, really think about our patient safety, and really try and help this patient as much as we possibly could. And I did say a little caveat at the beginning. I said, look, I might not be able to get it all out, but I'll get it so that you can hear better. You could see that movement there, and that was one of the smaller movements. So I've got to go in now with a fine end. I've gone with a fine end because I'm going to reduce the amount of air movement inside the ear canal with that smaller aperture to the end, and that's going to help to reduce the noise somewhat. So I'm just pulling down, but it's all in the recess as well. So this poor lady, it was a real tough old one to do, and she was physically exhausted by the time we got to the end of it because she was really trying to hold still, bless her. But we got there in the end, and we do leave a little bit behind just because it's right down the recess and the risk would have been too great. But the lady has promised me she's going to come back on a regular basis. But while you're there, did you see that? And it was just as soon as I got a grip, as soon as that little bit of wax started going into the tube, that's what would trigger this kind of this sort of involuntary movement along. Excuse me, guys. Sorry, just about breakfast. The air moved around my chest. That wasn't me burp, but I promise it was the air moved around my chest. So we're just going to lift this. Oh, there we go. Let's try and. You can see there's that little bit of movement just starting, and I had to pull out then. But we're getting just this last bit. I just want, if I can just lift this main kind of bulk that's sitting against the eardrum, and I've told the patient they can use a bit of olive oil then on a regular basis, and that will help to soften it, and it's more likely to migrate out of those deeper places if it's not such a substantial block of wax. So let's lift this. I'm trying, there we go, it's almost there. There you go. Oh, look at that, look at that. I don't know, I thought, I really hope this whole block pulls out here, but we'll see now in a second that we get to this last piece. I don't know why I'm trying to look over the top, guys. I'm not going to be able to see any better than I can now, to be honest. But, oh yeah, a little bit more of a wobble there. You can see me coming out. And what I would have to do is just stay outside the ear, just let the patient's tremor just completely subside and then go back in. So it was quite a long process to get this out. It's a short video, but I think the patient was in the chair for probably about 20 minutes, 25 minutes, and we've condensed that down to 5 because I did spend a lot of time outside of the ear as well. This is the awkward piece. See this piece to the right hand side? That's awkward. It's kind of dried and wedged into that area. Ideally, I need to pull across like this to the left, which is what I'm doing here without touching anything, but it's left that little layer underneath there as well. So let's get this piece out. And let's see, now this is where I'm super cautious here, because I really don't want this to move or to come away as it shouldn't really want. I don't really want it to come out there. You know, in little bits, I want it to come away as a bigger piece if we can, but there we go, out that's starting to come. There we are, and almost out. There we go. So that is, oh my goodness, what was that? About half an inch. So down to the last patient in this compilation, that was only a short one. This tailor's said this one was a really, really soft skin removal. So you can see we're just starting to lift off the sides. There we go. And it's a good peel, this one. You never know with a soft skin whether they're all going to come out or whether you're going to get these tiny little breaks all the way along. But it's coming away really, really well. I'll give this a little bit of a lift. Is he going to get it all out in one piece? It looks like it might all come out in one piece, actually. Oh, it did. Look at that. Nice. And the eardrum looks really, really healthy there as well. I think he does a little bit of tidying up. Yeah, there you go. You can see a little bit. Oh, look at that. So we've got a soft skin, on this side as well. Eardrums are visible, so the patient really wouldn't be having too much difficulty with their day-to-day hearing. But excuse me, it's quite deep. Let's see how this goes. He's going to get a grip. Oh, it's a little bit harder. There's a bit more substance to this one. Oh, can he hold on to that little tiny bit at the bottom there? Now, is it going to get wedged? That's what can happen sometimes. There we go. Lovely. That came out really, really well. And looking lovely beyond there. Perfect. Lovely shiny looking eardrum, that one as well. We've done a good look at that. There you go. And there we are, guys. So I don't think there was no ruler shot for that one. Taylor didn't put a ruler shot in. Couple of things, guys. Thank you so much for all the well wishes about having my new baby granddaughter. Yes, she is lush as well, guys. A lovely cuddles last week, and it was amazing. And they all smell so nice. She's so tiny. I always forget how small they are. You know, Theo's 11 years old now, so I forget how tiny they were. But she is absolutely gorgeous, and mum and baby doing really, really well as well. Thank you very much. Waxford. Monday is the start of Waxford. Oh my goodness me, have we got a doozy of a Waxford for you guys this year. There are some crackers in there. I think the shortest video we've got, is about 12 minutes long. Everything, I think the first video, I won't spoil it. No, I won't spoil it. But there's some really, really good ones coming up. I've got a last couple of days to do. I'm going to start all the edits for that now this weekend. So wish me luck with that one, guys. So yes, it's all coming. Make sure you stay tuned. Hit that like button. Hit that subscribe button if you're not subscribed already. You are going to get a video. If you don't know what Waxford is, you're going to get a video every single day from day 1 to day 24 of Christmas. Of December even. So all the way through the festive period for you guys as well. It's going to be coming on every single day. So keep your eyes peeled for that one as well coming up. You'll get us to see our lovely hats, which you guys have supplied for us as well. So and as always, guys, take care of your ears. Take care of your ears. Take care of your... Oh my goodness me. Why is this gone completely out of my brain? I say this all the time. Take care of yourselves. Take care of your ears. And take care of one another out there as well, guys. And as always, we'll see you for the next video. Bye, everybody.